Okay, it's 6:30. Let's start the meeting of the Sawyer County Board of Health and Human Services. Roll call.
Dale Schlueter,
Here.
Kay Wilson, here. Marshall Savitsky,
Here.
Chris Rusk, Bill Trepanier,
Here.
Don Pettit, here. Carol Pearson, Sabrina Dunlap. Here. You have a quorum.
Okay. Roll call. We'll stand for the Pledge of Allegiance.
Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, indivisible, liberty and justice for all.
Okay. Pledge of Allegiance. Madam Secretary, Clerk, compliance with the open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Okay, the meeting agenda is going to change a little bit. Tweed, would you?
Yeah,
Elaborate
thank you,
on
Mr.
that.
Chairman. Yep. Tonight we have our first night of our Lakota Ray liaison, Mr. Bill Trepanier. He's also the Secretary Treasurer of the tribe. We've also invited our medical director, Dr. Harry Malcolm, to come in tonight and speak about a RSV outbreak we currently have going on at our daycare and Head Start facility. So if we could just move that back just 10 or 15 minutes, Chairman, he'll be here in time to speak.
Okay. In the meantime, we'll continue. Public comments. Okay, first one up is
Lauren Peterson.
Lauren Peterson, please. Come to the
Yes.
podium and make you say your name and address.
Yes. Can you hear me okay?
Yes.
Okay. My name is Lauren Peterson from Mason, Wisconsin. And I just wanted to find out a little bit more when you talk about the refugee and homelessness discussion. I wanted to know what kind of the details are and kind of where we are at, especially from the refugee standpoint. Is there some kind of guideline, or not guideline, but is there some kind of plan, and where are we at in that plan, and what's the plan moving forward? I'm not really sure where that's at. And maybe when you get to that discussion, if you can let us know where we can get the current information on where it's currently standing. So that's my discussion. Thank you.
Thank you. Okay. Karen? Say that name.
Karen Royland.
Royland. Okay, thank you.
Hi, I'm Karen Boylan, Hayward, Wisconsin. I just wanted to address some issues with the refugee resettlement, and some of which you may address later on today. I just want to read just a little bit from 8 U.S. Code 1522 for authorization for programs for domestic resettlement of and assistance to refugees. When I refer to director, it's the World Relief Resettlement Agency in Eau Claire. Says the local voluntary agency activity should be conducted in close cooperation in advance consultation with state and local governments, and provide for a mechanism whereby representatives of local affiliates of voluntary agencies regularly meet representatives of state and local governments to plan and coordinate in advance of their arrival the appropriate placements of refugees among the various states and localities, and take into account the availability of employment opportunities, affordable housing, public and private resources, including educational, healthcare, and mental health services for refugees in the area, and also the secondary migration of refugees to and from the area that is likely to occur. It says also the Secretary of State shall assure that refugees known to the agency as having been identified pursuant to paragraph 4B as having medical conditions affecting public health and requiring treatment, report to the appropriate county or their health agencies upon their resettlement in an area. And I'm just curious because they seem to have bypassed local, notifying local authorities. Has any of this been done? And how long ago were the refugees' medical screenings done? And if they have, say, active tuberculosis, where will they be quarantined at? And then just another, it's notes from Federation for American Immigration Reform, Representative Susan Tully. She said state and local welfare programs that refugees can apply for include, but are not limited to, housing assistance, English as a second language program, and special ed programs, job training, employment research, job training and employment search assistance, social services programs, including translators, medical and hospital care, immigration assistant programs, citizenship applications and petitions for relatives to immigrate to the U.S., also known as chain immigration. World Relief Foundation, which is in Eau Claire, their agency, is currently importing refugees to our state, will assist them for the first 90 days with our federal tax dollars. After those 90 days, they become the sole responsibility of the community they live in. Funding for these programs place a heavy burden on the local communities, resources, police, fire, EMS, schools, hospitals, housing, and social services and tax dollars. Thank you.
Thank you.
Ron Pettit,
Thank you. Excuse me. Thank you. My name is Ron Pettit from Winter, 5191N Crawford Street, Winter, Wisconsin. Actually, the lady who just spoke covered a lot of my points, so it makes what I'm going to say a lot easier. She did reference the 100-mile radius out of Eau Claire, which is a hub, and we're well within that distance. My main concern is that they've bypassed the county board. That should not happen. That's not the way our government is designed to work. It's supposed to be a representative government. That's my main point. And she did cover that the federal money runs out after 90 days. That's also a problem. So how will the county be able to, all those services that she referenced is going to fall on the county. I'm concerned about that. The State Department says they've vetted these folks, but I've confirmed they've been vetted overseas. I'm not sure I can necessarily trust that kind of vetting, especially if it's coming out of a place like Syria, where some of them will be coming from. Let me see, what else? Sharia law. Now, Sharia law believes in their law. They do not believe in legislated law in our country. That's a problem. Now, most of the folks live in peace with our law until they get to a certain level, a certain population. I think that's got built-in problems in terms of law enforcement, and I'd hate to see that come to fruition. The State Department also, and this is from a guy named Ron Branstner from St. Cloud, Minnesota, who's a bona fide expert. He says the State Department is mandating that these refugees not be assimilated. So that's unlike the Swedish, and the Norwegians, the Irish that came here over 100 years ago that became a part of America. If you're not a part of America, there's a sense probably of alienation and not fitting in and not belonging. That also has repercussions. And I can see numerous social problems stemming from that. Lastly, and again, not all of these folks are going to be under Sharia law, but in Sharia law, and I know you all know this, but a woman has half the value of a man. That's a definite problem. I hate to see that come to fruition here. So my question is, can Sawyer County afford what's going to happen after 90 days, where there will be mandated housing, food, medical, interpreters, etc.? Can we afford that? Is law enforcement ready to deal with some of these built-in problems? And they're built in. You can see the problems coming, right? Let me see what else. I think the county board should consider passing resolutions to protect the rule of law, to head off some of these problems before they come to fruition. Now, because it's federally mandated, I'm not sure how much power that would have, but we should at least try, because we need to take responsibility for our own well-being, I believe. So that's it. Thank you.
Thank you very much. Anybody else? Okay,
Mr. Chairman, may I speak?
who is this, please?
This is Tom Jewell.
Did you sign up?
No, I didn't. I'm sorry. I thought I could just unmute my mic and say what I have to say.
Yeah, okay, we'll give you 3 minutes. Go ahead.
Okay, thank you. From the discussion at the November Health and Human Services Committee, it sounds like there was at least a temporary solution to the problem of delayed Meals on Wheels drivers reimbursement by the county advancing the SRC funds to reimburse the drivers until the SRC is reimbursed from GUAR. Yesterday, I found out from one of our local drivers that he hadn't been reimbursed yet for October. If the Senior Resource Center is going to recruit and keep Meals on Wheels drivers, a permanent solution needs to be found. I'm hoping the county will help the SRC find a way to reimburse the drivers monthly for their mileage. Also, I received an email from Pam Van Kempen from GUAR, which stated, "We are continuing to work with the Senior Resource Center and its board to increase socialization, health and wellness, and meal options in the Waldo area." I did reply that the Waldo Community Center Board is going to continue to pursue serving meals at the center, but we don't want to do it under an agency because it would involve too much paperwork. To be fair to the other seniors in the area, I suggested to Pam that they get in contact with Jeff Anderson from the co-op board to see if the co-op deli could come up with a meal for seniors, and the Senior Resource Center could chip in to make these meals more affordable. Pam did seem to be pretty receptive to this, and I did give Jeff Anderson at the co-op, from the co-op board, a heads up that they might be contacted, and they brought it up at the meeting, and they seemed to be looking into the possibility. And Pam did email me last week and asked for the co-op's email address so she could email them the GUAR guidelines. I hope the Senior
Okay,
Resource
it's-
Center will
wrap it up,
follow up
please.
with the partner with the co-op to make this happen. Thank you.
Thank you. Okay, now we need a motion to approve the minutes of last November's meeting.
I'll make the motion to approve the November meeting minutes.
You have a second? I'll second it. Everybody in favor, say aye. Aye.
Aye.
Passed. Okay,
Mr. Chairman, we are currently all here for the LCO liaison report.
well, let's go ahead and do that now then.
Okay,
Okay.
go ahead, Bill.
Good evening, everyone. To those of you who I haven't met, my name is Bill Trepanier. I am the Secretary Treasurer at LCO, and I will be the liaison here for this committee or for this board. I do not have a report tonight, but we do have Dr. Harry Malcolm here to talk a little bit about what's going on currently at our daycare and Head Start. In the future, I will have more substantive things to share with you all. Okay. Thank you.
Dr. Malcolm?
Hello. I hope everybody's doing well. Sorry, I went to the wrong place. So I
Thank
should
you for
know
coming.
better. I apologize. Okay, I'm Harry Malcolm, the medical director for the LCO clinic. There's been a outbreak of what's called respiratory syncytial virus at the daycare and Head Start. Respiratory syncytial virus is the most frequent cause of children under 1 year old being admitted to the hospital. It's a virus that everybody in this room has had at least once in their life. The problem is if you get it in the first 6 or 8 months of life. If you get it early, you can end up in a pediatric ICU on a ventilator. In fact, about 10 years ago, I used to deliver babies, and I had a baby I delivered that came in at 1 week of age, and the mom said, "I don't think my baby's breathing." And she laid the baby down on the exam table, and the baby was not breathing. We had to do CPR right there and intubate the baby, call a helicopter, and this baby had respiratory syncytial virus. A lot of times we can get it a second or third time later in life, and we get a much milder illness. And so the problem is that we have a large daycare there. Daycare is essential because so many of our employees are working families with young children. And in the last couple of days, we've had roughly a dozen children come up with RSV. 2 of them are now up in the neonatal intensive care unit up in Duluth. I gather both are doing okay. We felt that we have to close down that facility for the rest of this week. And the reason is just to we don't want to spread to the other kids. We have a lot of children that are under a year, and that's who's most susceptible, is children in the first year of life, especially under 8 months of life. So that's the situation that we're dealing with. We've had some COVID, but the COVID is not as severe as it was in the previous years. We've all been exposed to COVID or have had vaccines or both. And so we have some level of immunity. So COVID has not been as big an issue. And young children don't seem to get very sick with COVID. I still don't think I've seen a child that's been very sick with COVID in all my years. Well, last couple of years, COVID has been an issue. I've been a doctor since 1988, but COVID's only been the last couple of years. And then influenza is the other thing, and we really haven't seen any influenza yet in our community. I think the hospital has had a couple of influenza cases, but we haven't had any out at our clinic, and we do a fair bit of testing. And I'd be willing to take any questions or explain things further if people have questions I can help with.
Chairman, I got a question for Dr. Malcolm. Dr. Malcolm, is there currently a vaccine that we can give our children to protect them against this?
That's a fantastic question. There is a vaccine for adults that's new. It's for adults 60 years of age and older, because RSV, respiratory syncytial virus, is a problem for children under 1 and also adults over 60. The RSV vaccine is one shot and done. It's not a repetitive shot like the influenza vaccine. And we are offering that, and I know the hospital has that also. For people under 60, there's not there's an exception. There's also that vaccine that can be given to pregnant women. And the idea is if we give it to a woman when they're in the last couple of weeks of pregnancy, they'll have antibodies that would then protect that child after they're born. And those are both CDC recommendations now that are new this year. But for the young kids, for these children under 1 or 2 years of age, there's not a vaccine. There is what's called a monoclonal antibody. When I give somebody a vaccine, their immune system is making antibodies to protect them. We don't have a way of doing that for kids, but we can give them, instead of the vaccine, we can give them directly the antibodies. And so there's a shot called Beyfortus, Beyfortus. The issue is getting it. My sister, one of my sisters, I have several sisters, is a head pediatrician in a Ivy League pediatric hospital, and they can't get it for their kids. My son-in-law is an emergency room doctor at the University of Washington in Seattle. They struggle to get it. They can get some for their kids. I've been able to get exactly 10 doses of this. I got 5 more doses today. That's something that we can give to children under 1 year of age to help them not get this illness, and it lasts the whole season. But I need 10 times that many doses. There's just a shortage of that's. Looks like it's very effective. There's been a form of this that's been out for 20 years that you have to give every single month. So how many parents are going to bring their kid in for a shot every single month? That doesn't happen. This is now one shot for the whole season for children under 1 year of age. And I think that's going to become a bigger thing down the road. This is the first year it's been available, and the trouble is the manufacturer's just overwhelmed by how many people are asking for it, and we can't get it. I had 5 doses yesterday. I have 10 doses now. And I've contacted the daycare and Head Start to see if there's any children that would like it. But it won't treat the infection. It's to prevent the infections. Once you have the infection, there's no cure for the infection other than symptomatic care. It's a virus, and your body fights off viruses. So the treatment, like if you have influenza, there's a medicine I can give you the help. If you have COVID, there's a medicine I can give you the help. But for RSV virus, it's symptomatic care, supportive care. If they need help breathing, we have to give them that help. If they need IV fluids, we have to give them IV fluids. So that's how we treat this. Children, one other fact, and I'll stop talking. Children 1 year and under that get RSV, 3 in 100 will end up being hospitalized roughly. So about 3% will get sick enough. These are healthy kids. I'm not talking about kids that are born 12 weeks early or kids that have cystic fibrosis. I'm talking about a normal healthy baby that all of a sudden gets this, like my 2-month-old granddaughter, and ends up in a hospital. 3 in 100 will end up that way. So any other questions?
Doctor, yeah. How will you prioritize who gets these 10 doses? Are there immunocompromised children out there that would
Yes.
benefit from this?
There aren't that many immunocompromised young babies in our community. Certainly if someone's born prematurely. What's premature birth? That's if you're born, 10, 12 weeks or earlier than that. So normal pregnancy goes 40 weeks. Then children born after 34 weeks, they do pretty well. I've delivered about 800 babies over my life, so I've been on that side of it also. When babies are born preterm, especially before 30 weeks, they are much more susceptible because their lungs haven't formed. And so they get what's called lung disease of prematurity. And so they're more likely to get infected and seriously infected. And they can grow to be normal children, normal adults with good care. I think in our community, it's really going to be first come, first serve under what I propose for at least for the LCO. And I've talked to Dr. Dunlap at the Hayward Clinic.
Dr. Dunlap's online
Yeah,
too.
I'm here. Yep.
Hey, Sabrina, I'm sorry.
Hi. That's
I
okay.
don't know where you are.
Yeah, I'm everywhere.
I had, but I shouldn't say names because of HIPAA. I had one of my nurses contact you to see if you had Beyfortus.
It was too late, I think. Yep.
And because her daughter has it
Yep.
now, one of my nurses. And my information that she got from you was that you do not have the Beyfortus.
We do have some. We do not have. We have some doses. We do.
Oh, you do?
Yeah.
That's good news.
Yeah.
Are you giving any out?
Yes, a few doses we've given out. I think probably more now.
Okay. So we, you've been hearing what I'm saying. So we had this mini epidemic starting. I've been trying to contact. I got 10 doses of the 50 milligram dose.
Mhm.
I don't have any hundreds. So if kids over, there's 2 doses. If you're under 11 pounds, it's a 50 milligram dose. If you're over 11 pounds, it's 2 50 milligram doses. So my 10 doses can only treat 5 bigger kids, depending on their weight. So, okay, that's good news. I talked to D. Thompson. They don't have it at North Lakes, and I talked to Ben Turner, and they don't have it at Essential locally. So you and us are the only sources right now. So I don't know if you have any other comments. You've heard what I've said, Sabrina.
Yeah. No. It was interesting. People have been pretty hesitant to get it, but now I think they will be interested.
Yeah, I'm trying to get as many doses as I can because it has a couple years shelf life when I look at it. So one of my thoughts is if it doesn't happen this year, we can use this epidemic to try to get people next year to take this more seriously. the issue is this is the first year that this has really been available as an option for us. And so I think both on the medical side for medical providers, also for patients, we're all trying to figure out how to do this. But this little mini epidemic that we have, I think, is a wake up call, at least for us. I don't know. Sabrina, Dr. Dunlap, have you been seeing much RSV there?
We're starting to see more in the ER. We haven't had a hospitalization yet from it. Well, we did, but it was transferred out. So yeah.
Okay. Okay. Good enough.
Well, doctor, this is very encouraging that our communities work together and share these medications and antibodies that we currently have.
Yeah,
Thank
and
you.
just a kudos to the hospital. I only had 30 RSV test kits, and so we were able to call the hospital, and they were able to loan us some today. We've loaned stuff back and forth with the COVID issue also. So I appreciate the hospital being a willing participant in helping us out, and vice versa. So, any other questions, or Sabrina? Any other comments?
No,
Okay.
I'm good. Yeah.
I hope I didn't bore everybody too much. Thank you for the time. Okay.
Anybody have any questions, comments? Anybody online?
I have childcare commitments, so I have to run, if that's okay.
Oh.
Okay.
Thank you very much. I know that our people are Health and Human Services and Public Health. Is there anything the county should be doing or just supporting you as always?
Yeah, so Public Health has actually consulted today with LCO, and as far as we are aware, there aren't any other daycares that are having any major issues at this time. So it's good for us to really be on, knowing about this early and being able to inform people. So we have what we need for right now for resources.
Right now, how many diseases are going on that we're supposed to get vaccines for? I mean, shingles,
There's-
COVID, this. that.
Yeah, there's quite a few.
Uh,
Mhm.
Like, yes, very much so. Very much. Okay, 8. Committee reports, LCO liaison, we had that.
Are you going to report on?
Yeah, I can
Yeah.
report for Senior Resource Center. There's a written report that is included. It just came late this afternoon from the Senior Center. The cookie and craft sale, bake sale for fundraiser is this Saturday. So even if you don't partake in all the sweets yourself, perhaps consider gifting some cookies as a fundraiser. The meal cost tool, that's the analysis of how much it costs to make meals at the Senior Resource Center, including all the driver reimbursements, et cetera, was completed, and there's a 0.01% difference from last year. And you can see the percentages there of the preparation that goes into the meals. They have a suggested contribution amount of $7. As we've heard in the past, not much of that is reimbursed unless it comes through Inclusa as part of their program. So it is a program that's always going to be in the red. And we're still looking for a cook in Stone Lake, as that person has retired, and I will investigate. We have a meeting tomorrow night, and we'll find out what happened with that Meal on Wheels reimbursement, and I will report back to Mr. Alvarado.
Thank you very much, Lynn.
Nope. Oh, it's the administration report. I am going to share now. If I can get it up here. And we're going to see if I can make this work here. If not, I will just kind of talk to something. So, the big news to report, and sad news, yet we want to be happy for her. Patty, our fiscal manager, has announced her retirement after over 33 years with us. So although we're very sad to see her go, and we know that we will be losing a lot with her leaving us. We also are very happy for her to be able to leave with good health and move forward. So we'll be working on what things look like after she's gone. Right now, we have been working very hard to try to figure out all those pieces that she's been doing over time. When somebody's been with us for so long, they just do it naturally and don't necessarily remember all those day in and day out things. So been working very closely with the departments and with the supervisors to hopefully identify as many gaps as we can before she departs. Her last day is January 2nd. And we will hopefully be having some party plans and be able to invite the HHS board to be able to say goodbye. So, and she will be, she'll be able, she's on today. So she'll be talking with us towards the end here.
Do you have a potential replacement?
Not at this time. Nope, we're still looking through things. The positive thing is we did have an open position, so I'm probably kind of jumping ahead on Patty's things. We did have an open position with the fiscal assistant, excuse me, and we had a number of very well qualified people. So we're hopeful that our candidate will say yes, and we'll be able to fill that position and move forward. So it does feel good that we were receiving some good applications while we had positions open for over 6 months or greater. It's kind of a little turn of the tide. We hate to even talk about it too much because that's not how things have been. So hopefully it will continue to look good. Anything else on that? Okay. The only other thing that I have as far as the admin update is that Governor Evers has declared 2023 as the year of mental health. And many of the things that he has done is increase budgeting towards mental health services and as throughout this year. And in addition, we have seen 17 million of federal funding be put into operations of the 988 Wisconsin Lifeline. And that is a number that people can call or text or chat. I'm gonna get that, yes, and he's gonna talk. Oh, and I'm on mute. Okay, now I'm gonna present this. We got it? Okay, so I'm not sure if it'll go or not. Nope. Okay, so let's get this and can you mute am I muted? Make sure I'm muted there. Okay, let's try it.
And I'm First Lady Kathy Evers.
I was proud earlier this year to declare 2023 the year of mental health.
So as we kick off the holiday season, we want to remind Wisconsinites to take good care of yourselves, your mental health, and each other.
While the holidays can be a happy time for some, we know this season and the expectations surrounding it can also cause people to feel stress, anxiety, loneliness, and grief.
It might be especially tough for those who've lost a loved one or faced other unique challenges over the past year.
But here in Wisconsin, no one carries their burdens alone.
So if you're able, check in on your neighbors, friends, and loved ones. And no matter what challenges you're facing, it's okay to share your feelings and ask for help.
Whether it's a mental health or substance use crisis, or you or someone you love just needs someone to talk to, help and support are available 24/7 with a call or a text at 988 or chat at 988lifeline.org. 988 provides free and confidential support, and you'll be connected to a trained counselor who's ready to listen and help.
You can also find resources and strategies to build your strength and resilience by visiting resilient.wisconsin.gov.
Remember that help and hope are always available. Let's take good care of ourselves and each other this holiday season, Wisconsin.
So as we, now we should be fine. Thank you to Alicia for sending that through to me to make sure that we're sharing about all of the mental health services that are trying to be put in place as we move forward to assist us. And as we're talking about, oh, and then that is it on the admin update. Does anybody have any questions?
No, I don't see any hands.
Okay. Okay, moving on. Next, we when we had our last meeting, there was just questions on whether anybody had heard anything on additional on the refugee or possible homelessness. Andy has reached out and has what we know right now from a county perspective.
Yeah, just based on the public comment at the county board meeting and then what I've seen in the news and heard the discussion. To date or up till last week, we hadn't received no communications with World Relief or any updates directly to the county on potential political refugee resettlement here. So I did reach out to the World Relief, to the person who was essentially the person leading the discussions in the Eau Claire area to find out what was going on. And I understand they're authorized or have the ability to work in a 100-mile radius, but they've not been in contact with us because they will not be settling anybody here. They're working with the people who they're partnered up with already, and that's in the Eau Claire area. So that's just to do a little background. That's what I tried to have a conversation with them to find out what was going on, and that was the response.
Yeah, Andy, to my knowledge too, I've never been contacted or informed that these folks were coming or that we had to somehow house them or anything.
No.
You either?
No, we hadn't been contacted by anybody. Julie and I had talked at the last meeting that we had nobody had reached out to us, so I reached out to them to find out what was happening, try to clear up anything that I'd heard, and they're not going to place people where there's no support system, and they're not establishing a support. They're not making any connections outside of the Eau Claire area to place people. That's, I guess, all I have to tell you.
It would be interesting to know how the Eau Claire area is dealing with this. Or is
Yeah, and
going
I
to
can only
deal
give
with
you
it.
a speculation. I've talked to my network, and I think it's a mixed bag in the Eau Claire area. They were working, or I don't want to say they were invited in, but there was some connection there with the city of Eau Claire. I've talked to the counties. I'm connected with the counties around there as well, and like Chippewa, Dunn, we're not reached out to, and they're starting to have conversations with them now to find out what is going to happen. It sounds to us like they were just talking to the city of Eau Claire. That's their partner there, and whatever nonprofits they're working with.
Okay, I guess that's good news. So.
That's all the news I have on
Okay.
quantifying it.
Thank you. Back to you, Gloria.
Okay, so moving into the adult long-term care report. That we did not have that in the agenda today. We were unable to get that completed. We had quite a few people out in the last week and a half over in the ADRC. So along with all the illness that we're talking about already today, we're also seeing it within certain units as well. So that sounds like everybody is taking a turn for the better over there. Phone calls continue to be steady in the ADRC. INA specialists continue to do their counseling options, and many times they have to involve APS staff due to the dual nature of some of these referrals. The other positive is the ADRC of the North. So we're in a consortium with other counties to be able to provide services. So some of our funding is a regional service, some of it is local. And so regionally, we have been notified that we are getting additional funding. And so the directors and the supervisors have looked at that additional funding to try to determine how best to spend that. Right now, we've asked to get additional data points on calls coming in, number of referrals from each individual county, so we can best determine where the needs are as we move forward. And then the board for the ADRC of the North then would vote on how that budget moves forward. So just to kind of explain how that works. Our dementia care specialist has, along with the typical newsletters and marketing posts, did complete a live training for our EMS staff. So a total of 16 people were trained in that training. So that's great for the dementia friendly. And open enrollment has closed now. It was open for Medicare Part D from October 15th through December 7th. So we've gotten through that big push. And right now we have had 74 open investigations from January to October in adult protective services. And those range anywhere from abuse and neglect, self-neglect, financial exploitation, and financial exploitation. So that is it on the adult long-term care report. Does anybody have any questions? And I don't think Carol's on. Carol, are you on? Did you have anything additional if you are? Nope, I don't see. So with no further questions, we'll move on to behavioral health update. I see Alicia's on the call and we have Joe in the room.
We had our CCS research last week on the 6th, and that was for our entire region. And I am very proud to say that we passed with flying colors. We had one deficiency that was something very minor, but with 4 counties, that's an excellent review. We have not yet heard if our research is good for 1 year or 2 years. The past 2 reviews that we've had in the past 4 years, we've always been given a 2-year research, but we'd have a different DQA surveyor this year than we've had in the past 4 years. So I'm not quite sure yet. I'm waiting to hear from Taylor, my counterpart over in Taylor County. When he finds out, he'll let us know. But everything went very well. So I'm pleased with all the hard work that was put into it. It paid off. We only have 2 contracted providers, and I was previously informed by one of the contracted providers she's no longer going to be working in CCS due to medical issues she needs to take care of first and get herself healthy. She's been very good to work with, and I'm hoping that once she is back to her healthy self, she'll take on a few clients. I'm just not sure how long that recovery period is going to be for her. CST, things are going well. We have 8 clients in there. We keep getting referrals. We have not discharged anyone. We had Allison Carlson, our coordinator. She attended her first in-person meeting since COVID hit, or I should say training, as well as our 2 service and support coordinators for CLTS. It was a joint type meeting down in the Dells for Children Come First. All of them took many things away from it. Some very good networking was done, especially for CLTS, because the state has taken away our ability to have pocket meetings. Pocket meetings were meetings within our region where we could talk with DHS support staff, ask questions, run situations past them, gain guidance. They took that away. And the only way that we can contact them now is by sending an email to them. Luckily, their response time is a lot quicker than we we have with the same type of situation with our behavioral health and our substance use email inboxes. They respond much quicker. So even though we are able to use that email, it's still much better to have the connections with other counties, especially smaller rural counties. So we've developed our own pocket meeting, so to speak, and we just had our first meeting today, and there was over 40 people from different county, even people from Jackson and Jefferson County who are on there. So that's how needed it is to have this communication. And we just decided, seeing as the state took that away, we would develop our own. So we're going to be meeting on a quarterly basis, and really got some good feedback today from other people, how they're doing things, working through issues, purchases, even discussion about bed bugs. So it was I'm really glad that other counties are supporting us in this, and we're all working together on it. We keep seeing increased numbers with CLTS, which I say every month. We are not sure how the impact of any of these people moving into the county, how if it's where the numbers are going to go. We just have to watch, be careful. We haven't seen any type of guidance come out, or we get a lot of updates from DHS, but nothing has come out yet. So we just keep watching for that. Our CLTS yearly review is this week, Friday. We have to have everything turned in. They picked 15 children that we have to provide every bit of information on that we have done over the last year. So that will be going on all day this Friday. They take about 2 to 3 weeks to review everything, get back to us. And then if there's anything that needs to be remediated, we will do it at that time. So there's been a lot going on as far as recertifications and program reviews. It always hits us pretty hard at this time of the year, but everything has been going well. Everybody's been working very hard, and I commend those people I supervise. They've been doing a great job.
Thank you, Alicia. Any questions for her? Joe, did you have anything you wanted to add tonight?
Well, I'd say.
Oh, you get in the mic on the microphone, please, just so that people can hear you online.
Regarding the crisis services, we tend to struggle with the transportation. We continue to have those issues. I spoke with Andy and Julia about this, and I have some ideas. Hopefully we can meet after the first of the year and look at how to further develop our own type of transportation for these emergency placements. I have somebody that is interested, and there might be some other people we can access. The other thing is just increasing problems with juveniles and placements. We've had a couple juvenile placements in the past week and a half, and it floors me that people don't have that children are placed in people's homes either through something through the tribe or here, and those folks don't have the ability to transport anybody to a hospital if they have to go. Everybody's always wanting to manufacture the crisis so that these people are detained and transported by law enforcement. I had two parents this week that said, we want our child in a hospital. So everybody wants to drive the bus, and say, we're going to have a crisis. A hold is that's part of a civil procedure, and we're not supposed to put people on holds by statute if they're willing to avail themselves to services. So if somebody's willing to go, we're not supposed to detain them and start this whole process. So Duffy gets a copy of a hold and it goes to the court and all this other stuff. But because there's less resources, there's more and more people wanting to have this happen. And it seems like it happens more with kids. Especially where they say, I can't get them. We either don't have a vehicle or we can't drive this far or whatever. And I understand it, but it's a struggle for us. It is, to use a system that doesn't have to be used for that. And then when it's my decision whether to, after I confer with the staff at the hospitals, whether to proceed with these commitments, and it just happened just several times. It happens where either through another agency, they're wanting to drive the bus and say, we want this commitment on this person. I say, whoa, look at that form, that emergency detention. It's got my name listed on it. I'm going to make that decision. It's not something we want to do. We don't want bigger government. We don't want everybody under a hold and forced to do treatment, especially a minor, So it's a struggle. There's a lack of resources, and it's finding its way to escalate things more just to get something done.
Joe, who are
Yeah.
these other agencies?
Well, it could be anywhere from the child welfare agency. It could be from a foster care agency. It could be from anybody dealing with the children. It could be the parents. The parents would say, I want my child to be in a hospital. I want them in a hospital. They don't get to make that decision, and oftentimes, it's a struggle, because when I send somebody out to do a mobile crisis, the worker says, well, the parents say they can't control them. They want them in the hospital. That doesn't get you on a hold. That does not get you on a hold. It's just like when somebody says, if they said they're suicidal, I had a call the other day on, was it yesterday or whatever? It was a kid that said, a kid got upset, said, I want to blow my head off, with a 12 gauge. And if you talk to that kid and he says he just said it, that doesn't mean he gets to be in a hospital, It's just that I think there's a lack of resources, but the transportation is a real issue, and we have to look to problem solve this. We really do. That's the cost, and we got to come up with a better plan. So that's all I want to say. But I continue to keep people in the placements they're at right now. We don't have any long-term placements in that place we won't talk about.
Yes.
Okay.
Thank you.
No jinxing us. Okay, Child Protective Services, Sarah is here. She has a verbal report, and she can report out on YJ as well.
Hello. So I guess we have two bigger updates. The first one being that we recently hired my old position, which is the ongoing youth justice caseworker, social worker position. We've hired Kim Lambert from the Hayward High School. She is or was a tribal liaison, which is great news for us. I think she's going to be a phenomenal resource and a phenomenal worker. We're very lucky to have gained her. And then, so what is going to happen there is the other ongoing worker currently has 14 cases. Kim coming in and being new will have 7 to 8 cases, and I will continue to manage probably the 5 most difficult cases. So then in CPS, we are making strides towards giving some of the kids that have been out of home now some of them have been out of home for over 2 years. We are working on giving them a sense of permanency. And we're getting adoptive resources for them. So this is happening because their parents continue to struggle with drug use and or other concerns as well, and they have not met their court-ordered conditions. So it's sad, but also good in the same breath that these kids are getting somewhere permanent for them. I think that's it. Any questions?
Oh, go ahead.
Okay, thank you, Sarah. Shauna is not with us tonight, but she has put her report in, and I didn't get any additional updates from her that are in addition to the economic support report. Any questions on economic support? Okay. Hearing none, I'm going to keep moving on then. So public health report, Julie has put that in. She's unable to be with us tonight as well. As you have already heard on the RSV, we are watching that. We're starting to see some increases in influenza and COVID. Seems like there's a wide range of illnesses out there, and many of them are non-reportable. They're kind of just the generic viruses that are out there that people are getting, and causing a lot of people to be out from work. The hepatitis C, she did mention that and show that we are one of the highest rated counties. This was a look back between 2020 and 2022. At that time is when we also had identified syphilis. So we did have a much more increased testing occurring during that time, which helped identify cases that were just going undiagnosed. In 23, we are not seeing nearly that rate. I think we might be falling off on our testing for both hepatitis C and syphilis, so that's something that they'll be working on. The other thing that I just wanted to note in the report is just the update on the WIC merger. That is going well. And a reminder that it's a 4-county merger, so it's Burnett, Polk, Washburn, and Sawyer. We are set to start January 1st to make that transition, and the name is going to be Wild Rivers WIC. So hopefully they can actually say that on the phone fairly easy. That was one of the things that we also looked at. It won't really be much of a change for anybody who's using the resources. It's going to be more for a change kind of behind the scenes as we move forward. And then I think the rest of the report is self-explanatory. Does anybody have any questions? Yes.
Yep, I do, Julia. Thank you, Mr. Chairman. Julia, what are the opioid grant funds now? What are they being used for? And you maybe mentioned that earlier, but I guess I just like a quick recap of what we're using them for.
So we have fentanyl awareness campaign going on. It's a combination of funding between what's being used from the opioid settlement and what we're using off of the COVID ARPA dollars. So I can kind of just talk in general. We're using, doing Narcan. So we have purchased that and getting more of that out there. Working with the schools. So we've done, I wish I would have brought my little assessment piece. We've done a number of assemblies and working with the schools. And now, right now, we are just kind of taking a pause and they're regrouping. They're going from the fentanyl awareness and moving more into what are those next steps? What are those hands-on pieces that we need people to do on prevention side? So they'll be regrouping with a new group of people to move forward in that next phase. So we can do a full recap on the funding in January so that we see that whole piece.
Yeah, and I just add what was approved to fund the fentanyl awareness campaign was a substantial portion of the funds we had on hand already, but we are receiving more. We've received more since then, and we're receiving allocation every year. So the fentanyl campaign, budget-wise, is probably through like a 12-month, 18 months.
That's we figured about through August. So August to August, really, on the spending.
Then, yeah, just one last question, Mr. Chairman. Julia, is there any barriers to people that are addicted to see an MAT provider or go through that program? I mean, do they need insurance or certain insurance to enter into a program like that?
Well, North Lakes, do you know what they do for North Lakes? I'm not familiar. So for everybody. So a sliding fee scale type of thing. I know though, if you're behind on payments and things, you can't get services. So there could be a barrier in that respect. And then Beziki's got services that serve the county. Whether there is enough services, I've kind of taken my thumb off of that pulse for a little bit. So it's too bad Julie's not here at the moment. It's providers, definitely peer support and peer recovery providers as well as just in general substance abuse therapy is minimal. We can always use more in our county.
Okay, where are we at now?
Okay, we are up to Patty, who has patiently waited online for us to give us her final fiscal report. There
So
you
you
take,
haven't, oh, I'm sorry.
no, I was gonna say, take it away, Patty.
Oh, so you have in front of you both your purchase service recap as well as your budget performance reports per unit. Overall, we are looking really good for this year. And that's due to a unexpected windfall that we got from the state reimbursing us back for several years back worth of expenses on some out-of-home placement.
Any questions?
Any questions for Patty?
Yeah, I do, Mr. Chairman. So Patty, this windfall effect that we recently received, is that a one-time basis or can we expect this annually going forward?
Nope, it's a one-time deal. And it was from like 2 to 3 years ago, so.
Yeah, it is unknown. So right now it's a one-time. They have talked about what does that look like going forward. It's really hard to understand how any funding would be coming forward on that. One of the things is to think about are there any programs or is there something that we want to designate at least a portion of that funding towards? Because it's not designated. It does not have to be put back into a particular place.
Those were years we kind of depleted our fund balance in those departments. Are we going to use any of this money to replenish that, or what are your thoughts?
It'll be held in the fund balance for human services. That being said, we've replenished that fund. If you recall, we had the I won't say surplus, but we were under budget in 2021. And so in 22, we applied some of that fund balance to replenish the human services fund, as well as the resource fund. So the human services fund has stayed full. And actually, because of that, when we budgeted for next year, we had budgeted money to transfer into human services this year, which has not been needed. And so for next year, we didn't even plan to put that transfer in place. So we're in a much better place than we were in looking here like 19, 20, 21, Joe.
Yeah.
Yeah.
Yeah. And we're and it's the positive thing is we're actually budgeting for the services instead of just taking the hit and then trying to figure it out on the back end.
It's always dangerous when I step into the finance, but the health placements, out of county placements are within budget for what's being projected. So we're budgeting for it. The one thing that I would say to keep an eye out for, since Sarah's sitting there, youth justice placements out of county are out of budget, or they're higher than anticipated.
Right.
So we're seeing a little bit more activity in that area, which I think Joe was alluding to as well with the juvenile comments. Yep.
Okay. That brings us, is there anything else that you wanted to cover, Patty?
I don't think so, unless there's any questions.
No, I just want to take an opportunity for all of us to be able to congratulate you and on your next move and wish you all the best. I know I'm going to be seeing you, but the board is not going to be. So thank you, Patty.
Thank you.
Well, we may very well invite Patty to our next county board meeting.
Yes.
Correct? So I hope you can make that, Patty, and we thank you for all your years of service.
Thank you.
I can't either. Okay. Correspondence reports, conferences, future agenda items. Anybody? Any suggestions?
I'll just,
Up to
if you have anything you want us to follow up on, let me know. I am, like Lynn said, have been in communication with Senior Resource Center, and we'll continue to keep that up.
Thank you. We are adjourned.
Okay, thank you.